Hi, my name is Nathan Mustaine, and I'm a fourth year medical student. I took the social medicine course a couple years back. Uh, I could not be there tonight because I'm out interviewing, but I prepared a written statement, which I will just read. Um, so, Social medicine is preparing leaders to partner with communities they serve and to provide effective services that both treat medical conditions but also improve the circumstances that promote disease and prevent wellness. Students are exposed to a social and academic environment where preconceived notions are challenged by colleagues from very different backgrounds, where theoretical ideas learned from books and classrooms are challenged, explored through lecture, discussion, team planning, and simulation exercises. And then we observe these ideas and theories in action. We visited sites throughout the area of northern Uganda where we interacted with people and organizations doing the work of global medicine, as well as the people and communities whose lives are impacted by these ideas as they're put into practice. It would be difficult to emerge from the social medicine experience without having gained a very healthy dose of humility and a greater appreciation for the complexity and difficulties that characterize global health practice. I feel I much better understand how important dedicated scholarship, long term and immersive, committed partnership with communities and exhaustive planning are to doing good medicine and public health work in the places that need these services the most. One of the more striking things I learned was both how immense and how profoundly good or bad can be the consequences of our actions in poor communities where we work that are not our own. I was struck by how absurdly irrelevant and futile the results of even large multinational, multi billion dollar projects can be, and the variety of reasons for their irrelevance and lack of impact. I was also struck by how much good we can do through medicine when we partner with our patients and communities to address the root causes of their health problems. Social medicine also helped me to know where to look for good information and data in preparation for doing medical work overseas. For example, last spring, I found some reports by the Ugandan government and the WHO about healthcare funding in sub Saharan Africa and learned that monies available for healthcare fluctuate rapidly by factors of 2 to 3, going up and down from year to year, and that monies available through the Ugandan government have gradually and steadily and predictably increased throughout the years. Um, is something that I didn't expect. This information has helped to guide my approach to projects that I'm involved with in northern Uganda, and I'm not sure I would have known where to find this information before taking the social medicine course. Social medicine taught me to challenge and question preconceived notions and taught me that solutions to healthcare related problems must be tailored to unique conditions of each community. The diversity of educators ranged from the leaders of Rwanda's Partners in Health program, um, who focus on partnering with the existing government system, to a Ugandan doctor frustrated by the NGO and government approaches to healthcare, who's now working to increase capacity through private sector initiatives. Perhaps most importantly, it taught me to ask the right questions. Excuse me. Both in planning healthcare interventions and in taking a medical history. How far away does a family live from their water source? Do they have access to latrines? Do they have access to credit, formally or informally? How's money earned and spent? What are the community's beliefs, desires, and practices with regard to their own health? What's important to them? Who's already working on the issues they feel are important? Who are our allies here? Who are the formal and informal leaders in the community? Does the community want outside intervention at all? What are the possible unintended consequences in this community of interventions involving foreigners? Who might be hurt? What evidence exists that can inform our planning and implementation? What will we do when things don't work out? Why am I doing this personally, and what are my own motives? How will I care for myself? So on and so forth. I made friends, learned difficult truths about myself, and learned that the cliche about people being the same everywhere is true, but that we can also be radically different due to the social forces that shape our thinking. These differences were frustrating at times during class discussion, but left us all better off, I think, shedding many preconceived notions developing new ways of seeing the world and learning to work with people very different from ourselves. Um, Social medicine also convinced me that a good understanding of public health is essential to doing good medicine, particularly in impoverished communities. And my plan is now to get an MPH after residency. In some ways, I'm actually more prepared to be frustrated when doing the work of global health, yet I'm also more prepared to enjoy it, and I think to do it well. I'm more excited about the future and less likely to take myself too seriously. This course changed me personally, but I think it will also change communities throughout the world as my classmates become global health leaders and providers. The wealth and breadth of ideas we wrestled with as a class inspired intense debate, stretched us mentally and personally, and challenged us to approach medicine with respect for our ability to do great harm and great good. It would be difficult for any graduate of this course to not consider the socioeconomic milieu in which they and their patients exist. I believe communities served by social med graduates will be more likely to receive services and interventions guided by relevant evidence and more likely to have their own goals shape the provision of healthcare. I think communities served by social med graduates are more likely to be partners in improving the health of their communities through locally driven medical and public health interventions that address root causes of poor health and seek to correct them through solutions that will last. Social med grads are better prepared not to be providers, but to be partners to the communities that they serve. And I think that says it all. Um, if anyone has any questions, feel free to email me. You can get my email from Mike. This is an awesome course, changed me